Good evening. How your health care will be delivered is about to undergo a massive overhaul. The Ford government today announcing its restructuring plans for health care. It's big on promises, short on details. Now, the government is going to create a super agency called Ontario Health to oversee the system. It will replace 20 existing health agencies and merge them into one, including Cancer Care Ontario, the eHealth Ontario, and Trillium Gift of Life.
What we're trying to do is take away the silos of care to allow the providers and the people in each local community to be able to do their best work.
So here's what you need to know. The current 14 LHINs, which are the local health integration networks created by the Liberals, will be dismantled. They've been widely criticized for creating too much red tape. Instead, there will be 30 to 50 local health teams that will provide seamless care from hospital to long-term care, for example, or anything else the patient might need. In theory, making it easier for a patient to navigate the system. The health minister promises it will not lead to more for-profit care. Any plan's success is determined by its implementation. Yes. How can you guarantee that patients won't fall between the cracks and that you're not going to create an even bigger bureaucratic mess?
The whole reason why we are doing this change is to create patient-centered care that connects patients to their healthcare system throughout their lives. Patients will be protected. They will continue to access healthcare services as they always have, and that they should not see any change in that whatsoever.
Now, we've actually heard most of this already because the NDP leaked draft legislation a few weeks ago on this. But overhauling the healthcare system is a massive endeavor. It's a $60 billion a year budget and makes up about 40% of the provincial budget. The health minister says that these changes are not about saving, but about putting the patient first. However, in her opening remarks, she did note that the administration cost for healthcare has gone up 30% in the last 5 years. The Registered Nurses Association, Long-Term Care, Ontario Medical Association, and Hospital Association all say they're optimistic about this plan.
The biggest question the OMA has is the how of it. We agree with the what, we agree with the why. We'd like to see what the how is.
How will this end hallway medicine?
Well, I didn't hear the minister say it would end hallway medicine. I think it's a part of the emergent government plan to address overcrowding in hospitals and end hallway healthcare. It's about reducing red tape. It's about reducing the amount of unnecessary third-party oversight, and that's clogging the ability of the system to deal in a hands-on way with the healthcare needs of individual patients.
The opposition, though, is sounding alarm bells over privatization.
The minister has not at all in her press conference this morning given us any sense whatsoever that privatization of services is off the table. And similarly with the super agency and the dissolution of Cancer Care Ontario, to be dissolved and folded into the super agency is not the right direction.
Now, there was a media briefing on this a short time ago, and they were very short on details. For example, there are no timelines on exactly how this will be implemented. There are no targets set yet, but they seem to have a plan, but not know exactly what the fine print is on it yet. And while the media was in that media briefing talking about healthcare, the government quietly released its income clawback for parents who are receiving autism therapy for their children. I'll have that for you coming up as well. Another bad day optically for the minister in charge of the autism file. More bad optics today for the minister in charge of changes to the autism file. A mother of a child with autism is accusing Minister Lisa MacLeod of manipulating and twisting her words to make it appear she was in favor of the changes. MacLeod rose in the legislature yesterday and quoted parents she said supported her changes to the autism program, which eliminates the wait list but offers more children far less funding. In a Facebook post, the Windsor mother, Sherry Taylor, wrote, quote, "How dare you use my quote in Queen's Park to make it look that it was written after the announcement in support of a plan that will harm our children." MacLeod avoided reporters today after question period, but in the legislature, when the NDP pointed it out, she apologized if the words were taken out of context. Now, MacLeod has also had to apologize for bullying a group of autism therapists who claim she told them if they didn't support her plan, it would be 4 long years. And more to tell you about on the autism front today. While the media was in a media briefing about the changes to the health care, the government quietly released the sliding scale of autism therapy based on income. We've been asking for it for days. So we know that the clawback begins at $55,000. This scale releases it at each stage of income. For example, if a family makes $100,000, they're eligible for 76% of the funding. Of course, parents are eligible for $5,000 or $20,000 a year based on age. They will face clawbacks under the income of $250,000, which is the absolute cutoff. You won't make any therapy funding if you make above that. And don't forget, therapy can cost up to $80,000 a year.